The hydatid cyst of the liver is a hydatidosis caused by the larva of the tapeworm Echinococcus granulosus developing within the hepatic parenchyma. Diagnosis begins with a discussion with the patient to identify risk factors. The physician looks for a history of contact with dogs, which are the definitive hosts of the parasite, or the consumption of water or food contaminated with Echinococcus granulosus eggs. The cyst may be discovered incidentally during an imaging exam like an ultrasound or CT scan, or during surgery performed for another condition. However, certain functional signs may be suggestive, notably pain in the right hypochondrium or epigastric area, described as a sensation of heaviness. The patient may also present digestive disorders like dyspepsia, mild jaundice, or unexplained febrile episodes. On clinical examination, if the cyst develops anteriorly, a rounded, firm, painless, resilient mass that moves with respiration may be palpated. When the cyst is located deeper, diffuse hepatomegaly is generally observed. Lower-lying cysts may mimic a renal or abdominal tumor. Paraclinical examinations. To establish an accurate diagnosis and assess the extent of the disease, several paraclinical examinations are performed. These investigations allow not only the confirmation of the presence of the hepatic hydatid cyst, but also the evaluation of associated complications. X-ray imaging is often performed to look for indirect signs related to the presence of a hydatid cyst in the liver or its complications. Although not specific, it can provide important clues, such as an elevation of the diaphragm caused by the compression exerted by a large cyst on surrounding organs. Calcifications in the hepatic area. These appear when the cyst is old or undergoing fibrosis. An air fluid level under the diaphragm, often visible in cases of superinfection. It is not uncommon to find hydatid cysts in the lungs in patients with hepatic cyst, especially if the infestation is disseminated. Although of limited diagnostic value, X-ray imaging remains a useful first step in the overall assessment of the patient. The abdominal ultrasound is the reference examination for diagnosis due to its sensitivity, safety, and accessibility. It provides a clear image of the cyst, a rounded and anechoic, meaning it does not reflect echoes, appearing as a dark area, with well-defined borders, and with posterior acoustic enhancement due to the liquid content of the cyst, which intensifies echoes behind. Ultrasound also allows classification of hydatid cysts based on their appearance. CT scanning is used as a complement to ultrasound, particularly in specific cases or when the diagnosis remains uncertain. It provides detailed information on the exact location of the cyst, its anatomical relationships with surrounding structures, and helps plan a possible surgical intervention. It also allows the detection of ruptures, vascular compressions, or fistulas that may not be visible on ultrasound. Biological tests complete the diagnostic workup by providing information on the patient's general condition. Liver function tests are often normal because most hepatic hydatid cysts do not affect liver function. Sometimes, cholestasis or cytolysis may be observed in cases of biliary tract compression or secondary infection. Complete blood count, or CBC, shows hypereosinophilia, meaning an increase in the number of eosinophil, but it may be absent in some cases. The erythrocyte sedimentation rate is usually normal, but becomes elevated in the case of an infected cyst. By detecting specific antibodies, serology confirms the diagnosis in the majority of cases. However, it is important to note that a negative result does not necessarily rule out the presence of a hydatid cyst.